Today we welcome Modern Hygienist board member Alyssa Aberle to our discussion. Alyssa is a hygienist in Colorado who works at some community health center as well as with the Colorado Dental Hygienist Association. Alyssa, welcome. Thanks for joining us.
Yeah, thanks for having me.
I wonder if you could kind of share your experience during the pandemic. I know you work at a community health center, which is a different setting than a lot of hygienists. Can you kind of describe what things have been like for you over the past couple of months?
Sure. So I actually coordinate a school-based dental program for a community health center. And so back in the middle of March, we were kind of starting to slow down because of spring break coming up. And then some of the schools decided to close, which we thought after spring break we might be back up and running. But here we are in June, and that didn't play out that way. So we definitely knew things were going to look different, especially from a school-based perspective. But then as we saw, a lot of things started closing down and things looked different for the dental industry as a whole. Fortunately, being part of a larger community health center, we have integrated services. So our community health center, we have 20-something sites now that have medical clinics, and 7 of those have dental clinics. And we have integrated medical, dental, and behavioral health services, as well as wraparound resource services for our patients. And so we've been really fortunate that through all of this, our dental team, for the most part, has been integrated in with our medical team and been used in some alternative roles that we weren't doing before, but now have been become part of what we're used to on a day-to-day basis. So the first thing that we did was we started doing front door screenings at all of our clinics. So as patients were coming in for medical visits, the dental team was there, and we would ask screening questions of patients as they came in, as well as in some clinics take their temperatures, and we were kind of the triage for the clinic. And then as things continued, our health center kind of took the initiative to start some drive-through COVID testing sites. And so our dental team has really been utilized a lot in those roles since our dental clinics haven't been operating at full capacity. We've only been seeing emergency patients. And so a lot of our dental hygienists, dental assistants, dental office team, they've all been helping out with our drive-through testing. So that's one of the roles. And then our dental hygienists have actually also been working with our nursing team, doing some chronic care management of our patients in our health center that have diabetes, heart disease, some other chronic care issues. And so we've been doing some phone calls and telehealth visits with them to kind of check in, make sure that they're doing okay, and then do some behavioral health and mental health screenings for them as well. So yeah, we've been kind of tossed into a lot of new roles, but it's been great.
Mm-hmm. So I imagine that, you kind of had a little bit of a training curve to get ramped up with some of these new things. What was it like kind of stepping into these roles? What did you have to do to get ready to do them?
It's actually been pretty nice because I think the medical team has really seen the education and background and knowledge of our dental team isn't just teeth. We do know a lot about chronic care management. We do know a lot about diabetes and inflammation in the body, and can serve in those roles. And so that's been really nice, kind of a mutual appreciation of both sides, and seeing that dental professionals are healthcare providers and we can serve in those roles with relatively little transition, a little bit of training, but relatively little transition. And then I think just kind of realizing that our team can be more integrated than we even were before. Like, we have a health center that's integrated, but it was kind of like medical's over here and dental's over here, and we kind of keep in our own places. But I think the nice thing has been to see that we really can integrate even more. So yeah, I mean, there was like some training, because obviously none of us have ever done a drive-through testing of anything.
Yeah.
But neither had the medical team. So it was kind of a learning curve for all of us, and learning as we go. So.
Mm-hmm. What type of protective equipment are you wearing when you're working with people at a drive-through testing site? And what was the whole process like for you?
Yeah, so when we first started, there was just a designated team of people. I was on our original team before we kind of expanded to some new sites. And so we received a bag that had all of our PPE in it. So it had a couple of boxes of N95 masks. It had a couple of just regular surgical masks. It had a pack of gowns. It had goggles or eye protection of some kind. It had a face shield. And then some of the health centers and now all of the health centers for the people who are actually doing the swabbing or the testing, they do have the option to have like a kind of a coverall zip up suit as well. But most of us are just wearing like an isolation gown with the N95 and a surgical mask and eye protection and face shield, which when we started, it was March. So we had a few days where we had lots of layers underneath our gown because it was so cold. And then now it's 90 degrees. And so a little bit different.
Yeah, I imagine it's kind of oppressive with all of that protective equipment on.
Yeah, we've changed our hours to be starting earlier in the morning and trying to finish around noon, where we were going like 9 to 3. Now we try to start 7:30 or 8 and be done by noon, because the middle of the afternoon with all that stuff on, standing in a parking lot is not comfortable for anyone.
Yeah. In terms of the other interactions with patients, what type of stuff have you been doing the last couple of months, and how has, you mentioned a little earlier, you have training as a hygienist in all sorts of inflammatory conditions and other things. How has that knowledge come into play as you've worked with some of the medical patients?
Yeah, it's been really nice, because we do talk to our patients in the dental clinic about their diabetes and if it's controlled, and medications that they're on, and other conditions, heart disease, Alzheimer's, other inflammation-based diseases that do correlate or have some link to periodontal disease. So we talk about that stuff, but then kind of flipping over where that was our primary purpose of talking to the patient about those conditions, and then dental was kind of like a side conversation that we were having. It was, like I said, it felt like an easy transition, but it definitely was a little bit of a mindset shift, because our first inclination is always to talk to them about dental needs first. But it was relatively easy, but I think it'll help us in the long run as we go back to clinic and we start seeing these patients again in the dental clinic, and we now are way more comfortable having some of those conversations because we've been doing it for a couple months now. And I think even some of the patients are going to be like, oh yeah, we talked and you're the hygienist, but you also knew about all this other stuff. And so hopefully that'll kind of bridge that medical dental systemic gap.
Mm-hmm. During the shutdown, when non-emergency dental procedures were not permitted, were you seeing some emergencies come through the clinic, and what type of dental cases came in the doors?
We did kind of see a steady interest for those appointments. It wasn't a full schedule every day for sure. We had a dentist in our clinic almost every day, and like I said, we have several locations, and we did consolidate to one clinic on the east side of Denver and one on the west side of Denver to better utilize our resources. But I mean, we did see patients come in for emergencies. I think at the beginning, especially, patients were hesitant to come in. I mean, they were hesitant to go out of their houses at all. And so even the patients kind of would second guess, is this really emergency? Do I really need to go into the dental clinic? But the patients who did came in were very appreciative and commented on how well we were handling the protocols and how safe they felt. So I think that's always a good reminder to our patients, is that we are taking it seriously, and we do want to take those protocols seriously so that they feel comfortable as well.
Mm-hmm. With things starting to open back up, are you guys seeing regular dental patients again?
We have started phasing in some of our elective procedures. We started at our clinics with non-aerosol generating procedures. Our dentists really wanted to prioritize some of their prosthetic cases like dentures and partials and crowns and bridges that have been on hold for 3 months,
Yeah.
because some of those things are really crucial to people being able to talk and eat and do their normal daily functions. And some of those patients, we sent out a lab case in March and now we're in June and they've been waiting this whole time. So we definitely are starting to phase stuff in. We started with those cases, and then we have a plan at our health centers for how to phase in, kind of prioritizing the most urgent things first, and then getting to where we're doing more routine and preventative care, just to kind of keep the amount of people in the office down and make sure we have enough PPE and all of our supplies as they kind of ramp back up too.
Yeah. Has that been a challenge? I know dental practices that are just dental have had a real challenge obtaining and keeping a supply of PPE. For your health center, has that been an issue as well?
To some extent, I think because we've been operating this whole time, it's helped a little bit because we have been able to try to put orders in periodically and see what comes through. And then definitely being a larger organization that has been doing COVID testing and has medical services as well. We do have some organizations who have donated to us or who have found supplies for us, which has been great. But I know for a lot of small practices, I mean, here in Colorado, our governor asked dental practices to donate any extra PPE that they had to hospitals. And that was early on in all of this. But the fear was, okay, if we donate what we do have, then when we start back, we don't have anything. And it may be hard to restock what you do need. So we've been fortunate that we've never gotten to that point where we didn't have stuff. But I do know that a lot of smaller offices were expressing that. Even early on, they were saying they couldn't get masks before the practices closed down. So,
in terms of kind of getting things back up and back to seeing patients for the full set of routine services that most dental practices provide, how do you feel about the recommendations that have been coming out from both federal agencies and the Dental Hygienist Association and the ADA as well? Do you think there's been enough information out there for people? Do you think people can return to practice safely under the guidelines that are out there?
I feel like we're finally getting to the point where everyone seems to kind of have a consensus and be on somewhat of the same page. At the beginning, I know it was frustrating because information wasn't coming as fast as everybody wanted it to. But I think working for the Hygiene Association part-time and kind of being in a lot of those conversations, we just saw that a lot of people, CDC and ADHA and ADA, all these organizations, they didn't know about COVID either. So they were trying to learn it as it was happening. And I mean, information was coming and it was changing by the hour. So by the time you'd get something, you'd learn something else about it and you'd have to kind of totally pivot what you were saying or recommending. And so we also have to understand that some of these national organizations are kind of in a bind because they are trying to address the needs of all 50 states. And you have states like New York that have this high incidence, was having this extreme surge. And then you have other more rural states that maybe weren't having any or very few, and the curve was looking a lot different. But CDC, ADHA, ADA, they have to make recommendations that apply to all those states. So they're going to err on the side of caution, and they're going to go to the most conservative spot that they can be. And again, they don't have all the information. They don't know everything about this virus. So they're trying to make recommendations based on something they don't really understand how it's transmitted. They don't really understand how long it takes for the incubation period. They don't really understand the immunity and antibody response. So they're trying to wait until they get the information. But as we know, research doesn't happen overnight. All that stuff takes a while. So I understand the frustration that we all had and the fact that recommendations were changing daily and they were conflicting with each other. But I do think that those organizations were trying to stay on top of it and do the best that they could. I was talking to a hygienist who was practicing during the HIV outbreak and scare of the 80s. And she's like, imagine practicing as a dental hygienist when that was going on, and we didn't have social media, we didn't have email, we had TV, but the stuff that was on TV was for the general public, not specific to healthcare providers. And she's like, we had to wait until we would get a letter in the mail of the updated information and guidelines. And she's like, you guys think a week was a long time to wait. Imagine when you had to wait for the mail to come. So a little perspective, and we are just used to having everything at our fingertips instantly. And that was frustrating for people, I know.
Yeah. In terms of, getting back to work, a lot of practices have reopened. In fact, I just saw an article about the jobs report today that 10% of the job gains were in the dental industry this past month. And that makes sense because the whole industry was down, and every hygienist and assistant pretty much was laid off. I think it's for 95% for both. So everyone's going back to work, but the work is a little bit different. Are you in touch with hygienists who are at standalone dental operations and hearing from them about what that's been like?
Yeah, I mean, I've been in touch with a lot of hygienists through all of this. I'm working for the Hygiene Association. I've been constantly answering emails and Facebook questions and phone calls. And the president and president-elect of our state association, they both work for small private practices as well. So I feel like it's been a good way for us to kind of balance out our information from different perspectives. But yeah, I've definitely talked to a lot of people who either are going back to work here in the next couple of weeks or have already been back for, in some cases, a few weeks.
And in terms of kind of what you're hearing from speaking with them, do people feel that, it's comfortable to be back at work? Do they feel like they're getting access to the PPE they need to safely provide care for patients?
A lot of the hygienists that I've talked to that have been back, especially those who have been back for a couple weeks now, Colorado allowed elective procedures to resume on April 27th. So we were one of the first states to do that. A lot of them have actually said that they feel really comfortable. They were surprised going back into the office that it was like, okay, we can do this. This is not as far away from what we used to do. Obviously, there are PPE changes and protocol changes, but a lot of them are happy to be back. I've heard there are some that don't have the resources they need. They don't have the PPE, or maybe they did when they first started a few weeks ago, and now it's starting to run low and they're having a hard time replenishing, which was kind of a fear of a lot of people. Even if you had a stock that you had been building up, how were you going to replenish that after a few weeks? And we are seeing a little bit of that. But I do think that for the most part, I feel like everyone's doing their best to keep up with the recommendations and provide the things that we need to be safe.
What are you hearing from the patients that are coming through the clinic now? Are they feeling like it's comfortable to go get medical care at this point? Because I know early on, a lot of people I spoke with were just nervous about having to go to the hospital for anything that wasn't COVID related.
I mean, obviously it's a little bit of a skewed sample because the people who are coming in are the ones who probably do feel a little more comfortable. And so we may hear in a few months from some of those that chose to stay home and not come in for those procedures. But for the most part, people are very hyper aware of infection control now, whereas for a long time they weren't. They didn't understand why we did a lot of the things we did, or maybe they didn't even notice some of the things we were already doing for infection control. And now the general public is very aware of it. They watch to see if somebody wiped down their cart at Target. They watch to see if somebody wiped down the kiosk at the grocery store. So they're really watching that stuff. So for us, it's just been a really good time to educate them about the things that we were already doing in the dental practice for infection control and some of those changes that we have made during this time, and kind of walk them through that and why we've done that. So I think most of the patients have been really appreciative of that we are being proactive on those things. Of course, there's always going to be patients who are upset about the changes or don't like the changes or feel like they're inconvenient because of scheduling differences and things like that. But again, I think the people who are coming in are the ones who are appreciative and glad to get this treatment taken care of.
Mm-hmm. Now, you mentioned something that, it's well known in the dental industry that this is an industry that is very well versed in infection control best practices. Every dental professional is taking training on this. Everyone is pretty much involved in making sure the practice is up to, the recommendations and making sure everything is sterilized and everything is wiped down. You mentioned that patients are aware of this now. Are you finding that makes it a little bit easier in this time to say, okay, we have to put new things in place that might be more restrictive, schedules are a little more curtailed? Does that help that patients are understanding things a little bit because they're more knowledgeable about what it takes?
Yeah, I think so. I think when you explain to the patients why the scheduling is different or why certain procedures are being postponed, they understand it, and they've been hearing about it from all these different sources. So it's not just specific to the dental office. I think I was talking to my daughter's pediatrician because now they have to wear a mask and a face shield and a lot of stuff they never wore before. And I was like, it may end up benefiting the dental office because we've always been the scary people that wore the mask and you can't see our face. But now that everybody wears masks, it kind of makes that less intimidating to come into the dental office and see all of that gear. But we do have additional gear. But I think especially for kids or people who are already nervous about some of that stuff, now it's just a kind of a common cultural thing. And so kind of makes it less intimidating for them.
Do you think a lot of the, extra gear, things like, face masks or face shields have become really, really common at this point, and those were sort of an optional piece of equipment for a lot of people before? Do you think this is going to stick? Are these going to be things where, face shields are just going to be around and some of the other things dental practices are now doing are going to become just the normal?
Yeah, I mean, there's some of that stuff that, like you said, some people were using it. I know in California for a while, they've required face shields for certain procedures. A lot of the dental hygiene schools teach using face shields because it's really kind of better. I mean, you think about all the stuff I probably used to have on my face that now I'm not going to have on my face. And so in a lot of the social media groups and conversations that I've had, a lot of people have said, okay, if all these requirements go away and they say go back to the standard precautions that we were using before, what are you going to keep and what are you going to kind of let go away? I think most people have said if they could get rid of the N95 mask, they would do that gladly. But face shields and scrub caps seem to be people's favorite. And I think those two things for a lot of people are going to stick around whether they're required or not.
Mm-hmm. Yeah, and I think, in a lot of ways that seems to make sense in terms of keeping providers safe. Have you found anyone who is, I've seen a lot of media coverage that, the most dangerous job for, infectious diseases is dental hygienist. And then if you look through that list, dental careers are throughout the top 10 of that. The public's seen that a lot on the news. The news I see a lot lately is talking about how, dental practices are these dangerous places when there's an infection about. Do you think we can get past that as an industry? And if so, how do we help patients understand that we're doing all this stuff, we know how to make it safe? And quite honestly, the clinicians are the ones in the practice all day. You're there as a patient for an hour
Right.
or two, depending on the procedure. So, I mean, do you think we can get that across and change the message that, there's all these things we do to make sure we're safe and that we're not in, this high risk for you as a patient?
Yeah, the first thing is I think knowledge is power. And I think the more data we end up having, the better. Because when I take infection control courses, one of the slides that I almost always see is this comparison of how many dental professionals have ever contracted HIV from a patient, and the number is 0. And when you look at that data, and that's since the 80s, and nobody has ever contracted HIV from a patient, that means a lot. And so as we look at this, 6 months, a year from now, 5 years from now, 10 years from now, and we can see how many dental professionals and or patients actually contracted COVID in the dental office. So that may be a little hard to track, but the more data we have, I think the better people will feel about it, both clinicians and patients. And the more we learn about how contagious it really is through aerosols, I mean, that stuff is just the stuff we don't really know yet. So the more information and more research we have on that, I think it'll provide a lot of comfort to patients. But like you said, I think the other factor is that most of the major concerns that we've had for infection control in the past have been bloodborne pathogens, and we've never really put a huge emphasis on airborne pathogens. And so it's just kind of a new shift for us. But I mean, there was a time when people practiced without gloves, and when they went to having to change gloves for everything, it seemed like a big shift, but now I can't imagine not doing that. So, I think it will become more normal, and we will all adjust and adapt, and it'll be okay. I think we'll all be okay. We just have to shift our mindset a little bit.
Mm-hmm. I know you work with schools. You mentioned that at the top of this discussion. Are you hoping that things open up as normal in the fall and you can get back there? And what do you think that's going to be like going on that type of visit this fall?
Yeah, I mean, we've talked a lot about what that's going to look like. Not only are we in schools, but we're also using portable equipment. And both of those things kind of add their unique challenges. I mean, being in a new school every day or every week is going to be different than it was before. And again, like I said, the general public is more aware of infection control, where they may have used to put us in the cafeteria where kids were eating lunch. That's probably not going to happen anymore. But I think we'll have to just kind of figure out a new protocol, a new environment for our school-based program. I still think that school-based dental programs and nursing home-based dental programs and things like that will still operate. I just think they might look a little different. For our goals for our program, we may kind of shift them as well, because we've really been focused on sealants in the past, and we have used resin sealants, but we had already been looking at switching to glass ionomer sealants before all of this happened. But glass ionomer sealants can be used in a wet environment and can be used with less aerosols than some resin sealants. So, looking at some of the treatment options that do produce less aerosols and looking at minimally invasive treatment options, I think hygiene and preventative procedures will actually kind of take a priority over traditional restorative techniques in some settings, because they're less aerosol producing. So I think we'll look at things like silver-diamine fluoride or interim therapeutic restorations, which we can do in Colorado, or like I said, glass ionomer sealants, or things that can help treat the dental disease without the traditional hand pieces and things like that.
I imagine that'll also help with patient comfort, since the handpiece tends to be the thing that gets the anxiety going for a lot of people.
Yeah, and I'm an advocate for minimally invasive treatment options anyway. I have attended a lot of courses and work with a lot of dentists who really try to prioritize those treatments. And in some of those cases, you can eliminate local anesthesia, you can eliminate the drill, or at least minimize it significantly. So I think for some patients, they're going to like that transition. So,
well, all that is wonderful. Is there kind of any overarching, takeaway that you've kind of picked up over the last few months, and with, obviously a very unique experience during your career?
I mean, the biggest thing I've seen, especially on social media, is that definitely people's emotions have been heightened, both fear and frustration and being out of jobs and a lot of this unknown. And so I think just giving people the benefit of the doubt, whether it's your employer, whether it's your patients, whether it's the organizations who are trying to provide information as fast as they can, I think just giving people the benefit of the doubt and realizing that we are all going through this, and we can communicate a little bit better and be patient with each other. And I think we'll come out on the other end and we'll be better for it. So.
Well, Alyssa, thank you so much for joining us here today. We really appreciate it. Stay safe, and thanks for all you do for everyone in Colorado.
Thank you.